This episode of Medic Exchange TV Industry News is brought to you by Radiation Detection Company, a trusted provider of personnel dosimetry products and services since 1949.
Welcome to Medic Exchange TV Industry News. I'm Emma Buckley. The HIMSS conference is taking place in Atlanta, March 1st to 3rd, and we'll be interviewing close to 100 C-suite executives at our booth, number 8665. We're looking forward to meeting with vendors and hearing feedback on our interactive buyer's guide for radiology and healthcare IT products and services. We do have a few spots left for video interviews, so email us, flash@medicexchange.com, to book your slot. In industry news this week, we focus on the successful testing of the cloud computing technology eMix, which is used to securely share radiology images and reports. I spoke to Florent Saint-Clair, product manager of eMix at DR Systems, and Eric Maki, CIO at Great Falls Clinic, Montana, about his experiences adopting cloud computing technology. Florent started by telling us why eMix is different to other exam sharing technologies out there.
What we've chosen to do with eMix is to keep it as simple as possible, not trying to be a PACS replacement or a really complicated workflow situation. We basically give a user the ability to upload information to our cloud-based solution. Our system notifies the recipient downloads the exam and views it in whatever technology they want to view it in. And the simpler the workflow, the more widely adopted we expect it to be, and it's working.
And Eric, you've been using eMix for a few months now. How have you been finding it?
We had yesterday, we had a patient that had some chest CT and chest x-rays done here in Great Falls and went to their appointment, which is 3 hours away, a pre-op, got there and realized they don't have those images, which they were supposed to bring with them. Then they're going to have to cancel their appointment, drive home. Well, so they called us and said, is there any way we can get those images? We said, oh, sure. We just happen to have a solution to that. And in that half hour, we got the images to the physician, and they were able to go ahead and have their appointment and not have to call it off and reschedule.
MRI imaging is revolutionizing cardiac care. Diagnosoft has just launched a new product, Flow, which adds to their existing suite of cardiac imaging tools. I spoke with CEO Firas BenAchour and clinical manager Mike Luttrell to understand its true value, and Mike started off by explaining to us what Diagnosoft Flow actually does.
Flow allows clinicians now to more accurately and quantitatively assess blood flow through stenotic valves of the heart and or great vessels of the heart. For example, aortic stenosis, aortic valve stenosis, aortic artery stenosis, pulmonary artery stenosis, any other valvular disease, and how that affects blood flow through those valves and through the great vessels of the heart is now much better visualized and quantified with this newest tool.
Firas, what does having this technology mean to a cardiologist?
Cardiologists and physicians now have a single solution that would help them look at all of the data and quantify all of the images. And
Mike, how does Flow benefit the patient?
This allows a much greater diagnostic assessment that can lead to greater and more improved clinical decision-making in terms of patient treatment, and ultimately, therefore, can help improve patient outcome.
Our featured blogger this week is John Lynn, the EMR manager for the University of Nevada's Health and Counseling Center and editor of the nationally renowned blog EMR and HIPAA. Check out his blog and see for yourself why he's been featured in Forbes, the Financial Times, and Smart Money magazine. Now, if you're new to medicexchange.com, our website is an interactive catalogue of radiology and healthcare IT products and services. You can connect with an online community of 60,000 healthcare IT and radiology professionals. MedicExchange.com gives vendors the opportunity to position products and services right in front of senior-level, purchase-ready decision makers. Now remember to send press releases and news stories to flash@medicexchange.com, and of course you can follow us on Facebook, Twitter, LinkedIn and YouTube. Well, that's it for this week. We'll see you from Atlanta for the next edition. Take care.
This episode of Medic Exchange TV Industry News is brought to you by Radiation Detection Company, a trusted provider of personnel dosimetry products and services since 1949.